All right, so I'm Colby Spencer,
And I'm Gabrielle Purificato.
and we've chosen to do our presentation on the rabies virus. We do not know how to get Panopto to have our PowerPoint in slideshow form, so please bear with us. Anyways, moving on. So, an overview. First off, the word rabies, it's derived from the Latin word rabire, which means to rage. Now, the rabies virus is caused causes an infection both in humans and animals all around the world. It's usually caused by the saliva of infected animals and is one of the most lethal infectious diseases around. And also, there is no cure for the rabies virus. However, it's easily preventable.
So, rabies virus was first recognized in Egypt in the 4th century by the philosopher Aristotle, when he had thought that there was something dangerous in a dog bite. Dr. Francisco then discovered it in the 16th century when he called it the incurable wound. A vaccine was then created by Louis Pasteur in 1885. In 1996 in Kenya, there was many microbial threats of rabies virus. More than 100,000 deaths occurred in China between the years of 1950 and 2004. Then, lastly, in 2009, rabies posed a huge major health issue in the United States and Canada.
Moving on to the classification, the rabies virus's order is in the mononegavirals order. Moving on, it'll go to the bear with me, the Rhabdoviridae family, the Lyssavirus genus, and of course the classical rabies virus for its species. The rabies virus is presents itself. It's a rod shaped. It's got it's a bacillus, as you can see over here in the first picture on the top. It consists of single-stranded enveloped RNA, and the virus's genomes encoded with 5 different proteins in those in those envelopes.
Now for the etiology. Rabies virus is caused by the saliva of infected animals such as bats, dogs, skunks, raccoons, foxes, and the mongoose. Infected animals can spread the virus by biting another animal or a person. Rabies can also be caused from an open wound or mucous membrane, such as the mouth or eyes getting infected with saliva.
Now, the global risk for contracting rabies disease, you don't see it as much in, first world countries like the US and Europe. But if you look at the map, you can see the countries in red are at the highest risk of contracting the rabies virus. And these are Asia and Africa being the highest. And they have over a 95% rate of human deaths that occur in these regions from rabies. And this is because treating rabies in these countries ranges from anywhere from $40 to $50 usually. Um, and the reason that that's such a high cost to treat these is because people, when you do the conversion factor, people in these countries are really only making about $1 to $2 per day, every day.
So in this map, you can see a 2005 rabies virus cases in the United States. There were much more of a significant amount of cases reported on the East Coast compared to the West Coast, and these are noted in blue.
Now, the symptoms of rabies, you'll be you can present fever, a headache, drooling, mental confusions, muscle spasms, and also paralysis. People can also experience dizziness, vertigo, fatigue, loss of appetite. They can also have hallucinations and delusions. They can have feelings of panic. People have also said that they experienced pins and needles, sensitivity to light, of course, aggression, anxiety, nausea, and then These symptoms right here, you need to seek medical attention right away. If you start to have difficulty with swallowing, start to have seizures, dilated pupils, or they're unequal, and also brain death and coma can occur with this virus.
So, rabies virus is predominantly affected towards the poor and vulnerable populations who normally live in rural locations where the vaccine is not readily accessible. Rabies is transmitted when an infected animal bites a human or when a human comes in contact with an infected animal's saliva. So, globally, rabies deaths are most reported in children between the ages of 5 to 14 years old.
Now, the course of the infection, first we have the prodromal, why can't I say this word? Sorry. The prodromal phase, which is the onset of the rabies virus in humans, is about 2 to 4 days. The most significant symptoms are usually abnormal sensations uh, around the infected site, and about 80% of patients have said that this includes local and radiating pain, as well as a sensation of coldness or chilliness and itching and tingling around that site. Moving past that phase, you'll move into the excitation phase, where this begins gradually and can persist to death. And what you're seeing in this phase is you'll see this abnormal um, hydrophobia, where they have this fear of liquids, this fear of water that comes from them having such difficulty swallowing liquids and having to be so forceful and painful. And this all comes from spasms of the diaphragm and the muscles that have to do with swallowing and taking respirations, that it can get so bad to even just seeing the sight or the sound or even the smell of liquids can provoke this syndrome. And it can get so bad that they're so scared of drinking water and choking or anything around that death can frequently occur, and this is usually caused from severe dehydration, all because of that fear. Moving past that phase, you'll move into the paralytic phase. And now in this phase, you won't see hydrophobia anymore as much. That usually disappears. Swallowing will become more possible. It still will be difficult, but it becomes possible. But you can have a progression of flaccid paralysis that can develop. And and here this can also progress into coma, where you also have urinary incontinence, and also um, this can also develop perpetual vascular collapse that can happen, which will have death following after.
So, there are three categories of treatments depending on how you came in contact with an animal that has rabies. So for category one, this would be like touching or feeding an infected animal, or if an infected animal licks you on intact skin. Intact skin would mean that there is no cuts or openings to the inside of your body. For this category, there are no measures that should be taken. It would be recommended that you just go wash your hands or maybe take a shower. For category two, this would be having an infected animal nibble on uncovered skin, which would cause minor scratches or abrasions, uh, and technically these are without bleeding. So this would require immediate vaccination and local treatment of the wound, such as cleaning it with like peroxide or putting triple antibiotic ointment on it. For category three, this would be single or multiple transdermal bites or scratches or licks from an infected animal on broken skin. Um, this would this would mean that there is now an opening from the outside to the inside of your body, um, and contamination of mucous membranes with saliva from licks, um, on your eyes or maybe like near your mouth or something. This would require immediate vaccination and administration of rabies immunoglobulin and local treatment of the wound.
Continuing on with the treatment, any category 2 and 3 exposures have are at a higher risk of developing rabies, and these will require PEP, which is post exposure prophylaxis, which really is just the immediate treatment of the bite right after the exposure to the rabies, and this is meant to have the highest prevention the virus entering into the central nervous system. Since entering into the central nervous system, which if the virus does reach that system, imminent death will occur. Now, category 2 and 3 exposure poses uh, the risk is increased if the biting animal mammal is a known rabies reservoir or even a vector species. If the exposure occurs in a geographical area that rabies is still very present and prominent, if the animal looks sick or displays abnormal behavior, for instance, a dog is aggressive for no reason, foaming at the mouth, if a nocturnal animal is awake and out during the day, just abnormal behaviors, things you wouldn't see every day. Whether or if a wound or a mucous membrane is contaminated by the animal's saliva, as we said previously, if the bite if the animal that bites you and it was because and they weren't provoked to bite you, again, that's an abnormal behavior. And also, if the animal has not been vaccinated, the risk factors of the rabies virus is increased by all these things.
So, as for the survivability of the rabies virus, in countries that the rabies vaccine is affordable and readily available, this virus is very survivable when the treatment course is started right away after getting bit by an infected animal. If it is not treated right away or not treated at all, rabies is almost always fatal. And there was actually only 6 known cases of someone surviving rabies and not getting treated for it. According to the World Health Organization, in the year 2016, 59,000 people died due to rabies, in which 95% of the cases were from Africa and Asia. And among these cases, 99% of them were dog mediated rabies. Every year, approximately 30 to 70,000 people die from this disease, and this number is higher in children compared to adults.
Now, the vaccination for the rabies virus, in again, first world countries in the US, Europe, most individuals will have this pre exposure immunization by the age of 4 and 5, and uh, they'll go through a 4 dose vaccination of it, usually starting around 12 weeks old, and then about a month later they'll get their second dose. A year after that, their third, and 3 years after that, their fourth and final dose. Now, if you do contract the disease, then you have to get a lot more shots, and you'll have to get an immunization the day of the bite, 3 days after, 7 days, 14 days, 28 days, and 90 days after, to prevent any other further onset of this virus in your body.
So, for control, it is required that all pet dogs and cats in the United States and in the European Union be vaccinated against rabies virus within 4 weeks after the dog or cat turns 12 weeks or about 3 months old. These cats and dogs must maintain their rabies immunity by getting another vaccine every 3 years.
And thank you. This is our work cited, and that's rabies virus.
Thank you.